All right, so the last immune system issue we'll talk about is Wiscott Aldrich. This is an X-linked recessive disorder, and there's a triad of symptoms. They have thrombocytopenia, they have eczema, and they have immunodeficiency. So because they have thrombocytopenia, that's low platelet levels, they don't make platelets well, they have bleeding, and that's often present from birth. So they're going to have bleeding issues. The eczema is the allergic type, and because of the immune issues, they become super infected. So they have eczema lesions that get infected. It's very common for them to develop eczema herpeticum if they're exposed to a cold sore. Someone kisses a baby with a cold sore. By the way, this can happen to any child with eczema because it will spread in that open skin. But this child is even more prone to it because they don't have an immune system. So they can develop those herpes lesions all over. It's called eczema herpeticum, and it's very, very dangerous. They can actually develop herpes sepsis. They also can get herpes in the eye, which is herpes keratitis, because when they have those herpes sores everywhere, they can get it into the eye easily. So they're prone to super infections with this severe eczema. They also have an immunodeficiency caused by a lack of B lymphocytes and T lymphocytes. So they get skin infections because of the eczema. They get chronic pulmonary sinus and ear infections, and they have repeated overwhelming infections. They also develop malignancies because some of those malignancies are viral. Some cancers are caused by virus. So it's diagnosed by genetic testing. Management, well, they have to manage the symptoms. They get platelet transfusions to prevent bleeding. They get IVIG to provide passive immunity. They get prophylactic antibiotics. The care for their eczema needs to be very aggressive to try to prevent or lower the risk of those super infections. A stem cell transplant is curative. But this is often a fatal disease. The prognosis is poor if they don't get that stem cell transplant. So the family needs lots of emotional support, and also genetic counseling may be a factor. Now, I want to talk about one other thing when we talk about immune deficiency. There are some drugs and some therapies that can cause immune deficiency that you need to be familiar with. So we know some diseases that cause that. Now, there are some drugs and some therapies that cause that. Any cytotoxic drugs. Cytotoxic drugs are drugs that interfere with rapidly dividing cells. So these may be used to treat cancer, or they may be used to treat autoimmune disorders. Because they affect rapidly dividing cells, they can suppress the bone marrow and cause immune deficiency. Corticosteroids inhibit inflammation by blocking the movement of white blood cells. They also disrupt the synthesis of arachidonic acid, which is important in the inflammatory process. So they reduce the circulating T cells, they interfere with IgG production, they reduce antibody antigen binding. So there are several different places where they affect the inflammatory and the immune process. And they're used for autoimmune diseases. They're used for inflammatory diseases like allergies and asthma. They're used for allergies. They're used for people are maybe on them for MS. So think about autoimmune and allergy type things. They have a lot of other side effects. So corticosteroids are something that can be very, very helpful and life-saving in certain situations, but also if they have to be taken long-term, have a lot of complications. Cyclosporine is a med that's used to prevent organ transplant rejection, graft versus host disease, and is used for some autoimmune disorders. It suppresses CD4 T cells. And if you remember, those are the ones that HIV suppresses. So the effects of that can be similar, so that patient is at risk for infection. There are some, the biologic modifiers, the biologic meds that are very specific to certain disease processes. All of those are somewhat immunosuppressive. If they're going to affect an autoimmune disorder, it's going to suppress the immune system. So think about Humira, things like that. Humira was one of the first ones. Now there's a lot. Radiation, which is sometimes used to treat cancers, It's toxic to lymphocytes and neutrophils. So it can suppress the immune system depending on the dose of radiation and the location. Okay. All right. In the next section, we're going to talk about cancer in general a bit.